We've got an exciting webinar coming up today, and we are very pleased to be able to welcome the speakers. I'm going to ask each speaker just to introduce themselves very briefly, and then we'll get on with the main part of the webinar. So we're going to have introductions first of all, then we're going to have a presentation by Ketaki on the actual report that has come out from CAPI, on the whole question of social entrepreneurship, philanthropy, and mental health. And then we are going to have a discussion after that. Ketaki, do you want to just very briefly introduce yourself, please?
Yes. Hello, everyone. My name is Ketki Purohit. I'm the center head at the Center for Asian Philanthropy India, or CAPI as we like to call it. CAPI, very briefly, is a small research nonprofit based out of Mumbai. And our mission is to increase both the quantity and quality of private giving towards social good in India. And we do this by doing research and offering action-oriented insights and knowledge to the private sector to spur and inspire more giving towards doing good in India. And thank you so much, Chris, and to the Catalyst team for hosting us today.
Great pleasure, and thank you, Ketaki. We look very much looking forward to your presentation. Jasmine, do you want to just jump in and introduce yourself?
Sure, I'm Jasmine Kalha. I work at the Center for Mental Health Law and Policy. This is based at the Indian Law Society in Pune. We do a bunch of innovative work based on rights-based approaches to mental health and suicide prevention. Thank you for the invite today. Happy to be here.
Thank you, Jasmine. You're very welcome. Lovely to have you with us. Hi, Disket. Do you want to jump in and introduce yourself?
Yeah, thanks, Chris and the Catalyst team for having me. My name is Disket, and I run this mental health initiative called Mantalks. Mantalks is the mental health initiative of a foundation called Shantilal Shangvi Foundation. And our main purpose is to make mental health support more accessible in India to underserved communities. So I think we'll speak more about the work that we do as we progress, but I'll stop there for now.
Great, thank you. Thank you very much. So Ketaki, we're going to come back to you and invite you to do your presentation. I know that you and Lana have organized for screen sharing and so on and so forth.
Yes. So I'm just going to share my screen here. Give me one moment, please. I hope everyone can see.
I certainly can. It looks great.
Okay, great. All right. So happy to announce that we've launched our latest report at CAPI. It's titled Mindful Investments Philanthropy for Mental Health. And we launched this report last week. So I'm just going to share a few key insights from the study that we've done. So at the beginning of every report, we ask ourselves, why this topic and why philanthropy, and how is philanthropy kind of relevant to moving the needle on any particular issue. And mental health, of course, popped up because of the scale of the issue. The statistics are on the screen. 1 out of every 7 Indians has experienced a mental illness, and this is pre-pandemic, and the numbers have risen much further post-pandemic. It's also kind of percolating into the private sector's consciousness, given that we have numbers around what a massive loss it's causing to the Indian economy. And of course, when we were scoping this research, we realized that actually, from a non-medical perspective, there's very little that's being written about mental health. And while there are donor profiles, we wanted to kind of fill the gap in a comprehensive or analytical understanding of where is it that the private sector can really come in. And so this report really is a guide for both new and seasoned donors in this space and for philanthropy in general. So we did this research through primary data mainly. We conducted 43 in-depth interviews with experts from the sector, with donors, and with nonprofits, of course, working in the mental health space. But we also spoke to organizations working on poverty, on rural development, on biodiversity conservation, and on disability, to understand how they are integrating mental health initiatives in the programs that they are working on in those sectors. And the report really focuses on domestic donors because that's kind of the DNA of CAPI. We want to spotlight the strategies and the models used by domestic donors in India. So a little bit of context into the funding landscape. The total government funding that goes towards mental health is minuscule for a country as large as India. It's actually only about 1% of the total health budget, and it's kind of remained stagnant at this 1%. So the amount in crores, in rupees, is about 1,000 crores, and this translates to about 120 million US dollars, which, as you can imagine, is tiny for a country like India. Other developed economies spend close to 5% of their health budget on mental health initiatives. And then if you look at the graph on the right side, you see that contrary to what the WHO recommendation is, to spend a large proportion of resources on primary healthcare or informal community-based initiatives on mental health, India actually spends most of its budget on tertiary care institutions and very little on nationwide or district level, community level programs. And a chunk of this funding actually goes to 2 tertiary care institutions, one which is NIMHANS, which is the country's apex mental health institution, and another one in the state of Assam. So, looking at this funding kind of offers a window into what the private sector might be able to come in and do and where the opportunities lie for the private sector. And that's why it's kind of important to understand what the government funding is like. So, in the early 90s, the Tata Trusts were a big funder for mental health, and some of the biggest nonprofits in the space today, the Banyan, Parivartan, SCARF, actually received a lot of support from the Tata Trusts in the early 90s. After that, there's been kind of a winter in funding mental health initiatives, and we're seeing that it's only in the last decade or so that mental health is really beginning to feature on the donor agenda in India. This could be attributable to increase in awareness on mental health and how it's so critically interlinked with so many of India's development aspirations. And of course, COVID also has served to really catalyze the discourse on mental health and why it's important. And one interesting thing that we're seeing also is that partnerships between the government and social sector are also on the rise. And notably, it's not just the health departments or the health ministries that are partnering for rollout of mental health initiatives, but it's government departments across the board. So, for example, we spoke with the Mental Health Action Trust, which is a nonprofit based out of Kerala, and they've actually partnered with the Ministry of Fisheries in the state of Kerala to roll out a psychosocial support program for a community of fisherwomen. You have another donor called Empower, which is funded by the Aditya Birla Trust. And they actually, during the pandemic, started a program with the Airports Authority of India to conduct, counseling sessions and screenings for security and paramilitary personnel at airports. And what began with 2 airports during the pandemic is now 54 airports across the country. So these are some ways in which, the government is actually working with the social sector. Now, when we look at how donors are funding mental health, they're giving across the board, they're funding institutions as well as community initiatives and funding research studies and partnering with institutions to carry out these. We've observed that a majority of donors prefer to or have funded institutions like long stay homes or helped in the reform of hospitals, mental health hospitals, or have set up helplines or clinics or other facilities where you can go in and get treatment or counseling support that's needed. And the community models of mental health care are very slowly beginning to get traction. We have 3 key donors in India that are funding these types of models. And we've noticed that a lot of the big ticket funding has really gone to institutes of repute like NIMHANS and the St. John's Hospital in both of them in Bangalore from the donors that want to look at how science and technology are kind of relevant to mental health initiatives. Now, having said that, community models, of course, for a country like India present a relatively low cost option, but they're kind of struggling to get the traction with donors, and they haven't yet become mainstream because of a lack of resonance among the funding community. That's one challenge, of course, for the nonprofits. But what we've observed that although there's rising levels of interest in the donor community to fund mental health initiatives, unfortunately, there's a bit of a mismatch in the massive needs of the country and how much funding or support is actually flowing to this issue. And mental health proves to be quite a challenging sector for donors to give to. And we've kind of bucketed these challenges in 4 categories. The first is that mental health continues to have a lot of stigma attached to it. While a few donors fund the issue because they feel a personal connection, that kind of becomes a double-edged sword. And a lot of donors then don't want to be associated with a mental health condition. And so, unless more donors and the government kind of really engage in advocacy initiatives and programs to raise awareness, mental health may not rise as much on donor agendas as it should. The second and another big reason is that, unlike in other sectors, the impact in mental health is really not that visible. And so for a lot of corporate donors in particular who are really focused on quantitative metrics and quick outcomes, it becomes challenging for them to fund mental health as a space and have, include the subjective experiences of people with lived mental health conditions to within their kind of metrics and boxes that they use. The third is that, again, unlike in other sectors, which are perhaps a bit more mature and where there are, playbooks and toolkits and case studies, mental health is relatively new in the country. And so donors don't really have a clear pathway for their giving. And so despite the interest, they have to very often reinvent the wheel and speak to experts and do the groundwork or the legwork themselves of understanding how and where and whom to give to. And the final challenge is that in India there's capacity constraints, both in terms of finding the right nonprofit partner to work with you if you're a donor on your particular mental health initiative that you want to roll out. And India has a huge shortage of trained medical staff as well. And given that awareness levels are still quite low, it's challenging to find the right people to work with you to roll out your kind of vision. So it's broadly these 4 challenges that are obstructing higher levels of giving in mental health. Not to say that any of these are insurmountable. And in our report, we actually recommend a few things where donors can put their money for them to look at prevention, given that so much government funding is going towards treatment, to help community models gain a bit more traction, fund them, and really to reframe mental health as a collective imperative. And for more donors to kind of champion this so that the private sector really steps up in a bigger way to take on this burden. And there's a lot more that philanthropy can do. Of course, it has the advantage of being patient, of being able to take those risks, and of funding initiatives that can really disrupt the sector. So funding managed care models of insurance, for example, that are better suited for chronic conditions like mental health, funding more startups or social enterprises, funding centers of excellence, and a few more things that we kind of outline in our report. And the hope really is that this report will serve as a guide, and you can download a full copy from our website or scan the QR code below. And I'll stop here and pass it back to Chris to take this forward.
I realized I was talking to myself until I unmuted. Thank you so much for that presentation, Ketaki. That's first of all, I think the actual presentation itself is very clear, and so that's really helpful from our perspective as audience. And then the information that you've dug out, patiently dug out and presented, is also very good. And I would commend the whole report, by the way, which reads extremely well, and which we can download either through the QR code, or maybe, Ketaki, you'd be good enough to put a link into the chat.
I'll do that.
Yeah, that'd be great. A little trick, I suggest you put it in towards the end of our discussion, so that focus is kept on you and Disket and Jasmine until such time.
Sure.
But we'll definitely make sure that that link goes in. So Jasmine and Disket, I think what would be really interesting to hear from both of you given your different organizations and capacities would be, first of all, obviously your reaction to the report itself. That would be very helpful. But then secondly, I think it would be very helpful to know, as people who are seeking funding from time to time and also interacting with philanthropists from time to time, it would be very helpful to know how the landscape that has been painted for us, how that works for you. Disket, would you like to jump in first?
Sure. Thanks, Chris. I'll step in to first speak about the report. I think I'm personally so excited that the report is finally out. I think the first few conversations that Ketki and I had told her that, Montauk's is fairly new. I think we're now only 3.5 years old. But my journey in mental health is almost as new as Montauk's journey itself, because I was a corporate lawyer once upon a time, and then after a decade decided to switch over to the warmer side, if I may say so. But I feel like in my own journey with Montauk's, I've realized that the mental health sector has people working within it, whether they're donors or individuals that run organizations that are so open to sharing their own learnings, their challenges, their failures. But I personally felt that I would have really benefited if all of that information from the 50 to 100 conversations that I had with all these lovely people was just centralized somewhere and was easily accessible, and I feel like everybody's so forthcoming in sharing their journeys and challenges and learnings. But I think there's definitely a shortage of kind of centralizing that information and the practical nuances of the sector. So I would really kind of applaud Cappy, Ketki, Khyati for putting this report together and for making it publicly and freely, easily accessible, because I know that for newer entrants into the sector, whether they're donors or whether they're individuals that just want to work in mental health, it's definitely almost going to work as a ready reckoner, right? Because you've not only touched about concepts of mental health, and I feel like I love the way that you've even spoken about and explained mental health to people, but you've also talked about the legislative history, government policy, action, then where the private sector with philanthropists have come in, what the challenges are. And also, I think the flavor of just getting to hear from individuals who are in the space, I think is really beneficial, which I think is my favorite part of the report, to kind of, and since I've interacted with so many of the individuals that have quotes in the report, it's almost like I can hear them speak and echo the sentiments that are shared in the report itself. So I think reports like these are essential for the sector right now, because it's a complex sector in general, but also, like the report also discusses, philanthropy is fairly new when it comes to mental health in India. And I feel like we need more such centralized reports and centralized repositories of knowledge for the new people that are looking to invest in the sector. So I have so many notes from the report, which I'm going to share with you separately, Ketki, but so many good points that have come across, right? And I think I want to speak about one small point, because I don't want to take up too much time, is about the focus on a multi-pronged approach that is needed when it comes to mental health care, services, and programs in the country, right? But I feel like because so many multi-pronged approaches are required, and there are so many different nuances to mental health in general, I think it makes it all the more tricky for someone that's new as a donor to come in and kind of lend their money to the space. So I feel like that's why we need more such platforms where we speak from experience, share knowledge across public platforms. So thank you, Cappy, Ketki, Khyati, all of you for putting this together. Very quickly touching upon Montauk's, luckily for us, we're a owned and operated mental health initiative of the foundation. at least till date for all of our programs, we're fully internally funded. But again, through different interactions with initiatives that require outside funding, I have some secondary knowledge and information, but I think I'd let Jasmine step in and then maybe continue the conversation on the nuances and the funding scene in India.
That's great. Thank you, Disket. And obviously, Ketakia, we're going to want you to come back when colleagues have spoken to give your views on their commentary. That would be very helpful. Jasmine, welcome.
Thanks, Chris, and thanks, Cappy, for that report. I think I was just reflecting that when you said the winter period has been a bit severe in terms of funding. So it's actually really nice to see the level of interest that has come in for mental health and for philanthropists to look at the issue of mental health. I still feel it's a bit too few and too sparse. So clearly a lot more needs to be done, given the large gap that we are facing. Picking up from, I think, Disket's comment, had a similar opinion that I think reframing this mental health care gap rather than just looking at a treatment gap, I think might just be helpful for the sector. There are lots and lots of determinants for mental health, which are socio-cultural, commercial, political, economical in various in various sectors does one need to actually intervene to reduce this large mental health care gap. And so this is coming more from experience of trying to work with philanthropists and trying to either do new kinds of research or scale up interventions. So I'm going to primarily come from that space. I think I like the point that Cappy has brought up about the fact that the pyramid of services, the way it should be done, there is very little to minimal to almost zero funding that's going into preventive, promotive intervention. So I think that's one space that can definitely be highlighted. And linked to that, I think, is the issue of doing. I think we need both things. We need more innovation, but we also need to scale up interventions. Our experience has been that scale up in general is this big lacuna, like not much is happening. Everybody's focusing more on more innovation rather than actually picking up what works and actually taking it to scale. So that's something that we've struggled with. And I know Cappy has brought that out in the report as well. And also to say that I think we found ourselves in this weird spot where either it's research or it's implementation and very little to kind of bring that back together, say through implementation research, which is part of the work that the center does. And I think one is just struggling with trying to emphasize the need for evaluation and research, even when you're looking at innovation as well as scale up. So I think that's one reflection that I had from the report as well. Speaking of, I think what has been helpful in the sector for working with philanthropists, I think, is an opportunity to set the narrative of the global South, and especially in Indian context, it's to look at not, producing a counter narrative to the global North, which is primarily what has determined either what research or implementation should be. So I think there is some opportunity here to set the narrative, but I think to set the narrative, one needs to be very conscious that, it's not coming from personal interest, but actually being co-designed with players in the field or communities that we work with. So I think that's one thing I would want to highlight, along with just saying that I think trust-based funding has come up as a need. And I think part of that trust-based funding is to let the communities decide the course of action rather than this preset agenda that anyone might have. So just a quick reflection point, and I'll pause there and hand it back to you, Chris.
Thanks very much. By trust-based funding, is that the same thing as participatory funding? Is that the same kind of thing that you're talking about?
I suppose I'm looking more at the fact that when philanthropists are giving money to organizations, to just assume that the organizations have the wherewithal to do participatory and co-design and co-learn from their communities rather than come in as the preset experts to kind of create quick fix solutions. So I think it's more, how do you create a relationship of collaboration with your philanthropist versus a top-down approach of just saying, if which is typically what ends up happening in grant-based funding or research-based funding. I think there's an opportunity here to actually build a more collaborative standpoint, which we have personally benefited from.
Yeah, absolutely. One of the things that, one of the slides that really caught my attention was the whole question of, was the 4 points that you brought out, Ketaki, towards the end of the report, but towards the end of your presentation, which of course is stigmatization and the invisibility of impact, as it were, the no clear pathways, and the whole question of resources. Now, I think it would be helpful to do a bit of a deeper dive on that. And in this particular discussion now, would you like to comment first of all, and then we'll come back to the other speakers on that?
Sure. I think that mental health funding, first of all, requires a mindset shift. I think that a lot of these challenges are also coming up because donors are approaching mental health in the same manner as they would other sectors. But the truth is that mental health is relatively new, like I said earlier. And so, if you're a donor, then I think a mindset shift of knowing that your funding is actually going to be patient capital without the expectation of returns, or that often it might be actually a risky venture, and there might be some failures too, would kind of help in addressing a lot of those challenges. And as Diskette and Jasmine both said, I think that, and this is something that we've actually heard a lot in our interviews, that having a centralized repository would be really helpful, so that you don't have to do all of the legwork yourself, that you already have others who've shared their experiences and shared their learnings, and who've kind of set the path for you. And I think some of this is starting to happen, but in very bits and pieces. And there is a real need for someone to actually come in and bring this all together. And this report for us was a first step in that direction. And we hope that, together we'll be able to kind of find ways to overcome all of these challenges.
Mm-hmm. When you talk about a centralized repository, do you have particularly in mind the question of financing, I should say, and philanthropy, or are you thinking more widely?
I think definitely more widely. And when I say repository, it could be, a physical facility, like a physical institution, like a center of excellence that kind of pulls in perspectives from government, pulls in perspectives from mental health practitioners, from donors, from nonprofits. Or, it could be a website as well, where donors have kind of shared their learnings, and there are little case studies, and you have someone kind of curating the whole thing and ensuring that there isn't any misinformation, because there's a lot of that floating around as well. Yeah. And you have, players like CMHLP kind of keeping track of what's happening on the law and policy and legislative front as well. And so then it just becomes a knowledge resource for everybody that wants to use it. And there could be many applications, even outside of philanthropy, for this kind of a resource.
Yes. Interestingly, and to Jasmine's point about the global north, global south, I've just proposed a repository for the United States, which is going down a treat at the moment. I'll keep you informed on that one. But that's a different topic. Well, it's the same topic, but a different country. So just coming to the whole question of impact and its invisibility, as it were. I remember in those good old days, bad old days, when I was talking about this whole question of funding to the Gates Foundation before they, in fact, started to do this kind of work. They made the point that it was very difficult to ascertain impact, and And I wondered what you thought about that, Jasmine.
I mean, yeah, the Gates Foundation is perhaps not the best example, but I don't think it's invisible impact. I think the pressure is on us to actually define what impact really means for our work. So I can speak from experience of implementing our large community mental health program called Atmiyata, which essentially is, equipping communities to address their own mental health care needs. And it was a bit of a stretch to say, how best can you show its impact? At the same time, you do want to measure the impact and almost also, to that point about return on investment. So that's something that we've started including in our work, because that is oftentimes what the funder, not just the funder, but mainly policymakers will ask for. So I don't think it's completely impossible to measure impact. The pressure is on the implementers to define what that impact looks like and actually chart the pathway to reach that impact, and put in the adequate resources to get there. So it doesn't always need to be clinical outcomes, but actually we've started looking even at socio-cultural outcomes. For example, in Atmiyata, we looked at improvement in participation or improvement in quality of life, only because these were then important variables for us to think of what scalability would mean. I'm not too sure whether it's, and I think, of course, there is a hierarchy of the kind of evidence which is out there, and one can always discuss that as a separate question. But qualitative data, information, just knowing what you are doing works is equally important, because given this sector, one is really struggling with a lot of philanthropists, a lot of people in leadership position or policymakers doing things that they think are right, which comes from this certain commonsensical understanding, which is often not evidence-backed. So I think the pressure is on us, not so much on people asking for it.
Mm-hmm. That's an interesting point. I'm going to invite Uma to come in a second to comment, because she's had a lot of experience on this whole question of actually locating data. And I'll invite her. And I'd like to invite you, Christy, as well, to come in to give a comment on the report in a second. But let me come to you, Diskit, first of all, to the whole question. As we know, Ketaki identified these 4 areas, and they came out very clearly: stigmatization and so on. Where are you on this whole question of impact?
I was just going to raise my hand if you didn't ask me to come in, Chris.
You could do this. You could start waving at me.
I was looking for the emoji which says hands up. But I also want to pick up what Jasmine said. I think that there are definitions of impact that every program working in mental health in India has come up with, right? I think, yes, certain measures are qualitative, certain are quantitative, some are definitely visible, some are invisible. But I think the struggle for us in India and in mental health is that every program has its own definition of impact, its own definition of success. And it's so difficult to arrive at one set of factors that determine impact for any mental health initiative in such a diverse country like India, right? Specifically because, again, mental health is so influenced by your community, your experiences, how you've grown up, and every region in India is so diverse. I feel like that kind of multiplies the complexity of impact measurement of mental health initiatives. Again, just like Jasmine spoke about the Atmiyata program, I think there are so many programs in India that have, in a way, proved impact, shown evidence-based impact reports. But again, because every program, every donor has their own definition of success today, I feel like for new donors, especially, to come in, look at a program, assess what their impact and success story is, and to completely adopt, replicate, and scale definitely becomes a challenge, which is something that I've observed from my personal experience as well. I think, again, speaking of MUN Talks, because the foundation that funds our programs also kind of works very closely to operate the programs, the trust factor is extremely high, right? And I think trust is really, really important for any donor that donates to mental health programs, because yes, there are certain intangible impacts which you cannot measure over a small or even a long period of time, but they could be the true essence of impact for that very program that you're running. So yes, I think for us personally, the trust factor of our funding family is extremely high, because of which we've been able to experiment with small programs here and there and then run the larger service delivery pillars simultaneously. But I think when it comes to the question of impact, every panel that you attend will have a set of people with very diverse views on how they see impact and what they think should be the way forward for initiatives in mental health to measure impact. And I think that just kind of makes the whole matter even more complex.
Thank you, Disket. That's very interesting. Uma, did you want to comment on your experience of of being able to balance both quantitative and qualitative data in collection? Would you like to comment?
Yes, sorry, I switched off video because it's breaking. I'm not able to hear properly.
No problem, that's okay.
Yeah, see, impact assessment of mental health initiatives is challenging, and more particularly so in India because of its, you say, diversity and heterogeneity, and stigmatization is high. So people don't, it's underreported, largely underreported. KTG said that 7 out of 10 people are affected by mental health. Even it probably in actual scene, it is more because it's terribly underreported and limited resources.
Yeah.
So whether it's a NGO or even government supported agencies also, it is not, data collection is not so easy. Reliable data collection we need resources, and donors also. It's particularly if you take, for example, in basic needs, we had model, and under research, we used to collect data in different community mental health, capacity building. So relatively capacity building, yeah, training of health workers, it is funded. Even treatment also, it is fairly easier. Fairly easy means relatively easier to get fund, but not data collection and reporting. I think that may be applicable to many countries.
Yeah.
And integration with primary health care, now government is supporting, and it's happening. At least in South India, Karnataka, the integration is happening on a large scale. So that expenses incurred with mental health treatment also, it is difficult to find funds and assess impact.
Right. Uma, thank you very much for that.
Even human resource also.
Sorry, go on. Just finish what you were saying. Sorry.
Human shortage of human trained mental health professionals.
Right.
Psychiatrists or even researchers who want to do research. Mostly it is focused on psychiatric aspect of mental health, completely omitting the development aspect.
Right. So the impact of large-scale community programs, for example, it's a very different issue to the impact, of course, of the psychiatric or medical aspects, and that, of course, is very important. One of the things that I was reminded of, which many of us on this session know already, is of course that the mental health is, of course, part of a larger group of NCDs, and here we have quite a lot of learning to do from the way in which other people have measured NCDs in the past, and I think that would be quite important to reflect on. Christy, did you want to come in to make a comment? I know that you have done a great deal of fundraising in the field of mental health. And so the whole question of being able to report on impact will, of course, have come across your desk many times.
Sure, I'm happy to. Thanks for inviting me to speak.
I should ask you, sir, first of all, just to say who you are. Sorry.
Sure. Hi, everyone. My name is Christy, and I'm a consultant for organizations that work within the global mental health space and organizations that are thinking about how to work in the global mental health space. And I support organizations with commercial strategy and partnerships and fundraising and things such like that. So I've been in and around this conversation for a while, as Chris mentioned. And I think first and foremost, when it comes to measuring, everyone who's in this space is doing it because they want to have an impact, right? So we should be focusing on impact and metrics and things that we want to know about what our program is doing. And I think coming to that around mental health is difficult because what are you truly measuring here? Is it the absence of things like depression and anxiety? Is it the reduction in things like suicide cases? Is it the presence of resilience? Is it the presence of well-being? Is it the presence of happiness? And there are so many different ways to measure. And many programs rely on metrics that were frankly developed in mostly Western communities, like the PHQ-9, for instance, and validated in many other cultures and contexts, but still not developed for those cultures and contexts. And so there's a lot of conversation around what is the right thing to measure. And I think with philanthropists and funders, there is an open question on, how do I know the money that I'm putting in is having the desired impact on the other side? And how can I potentially compare across different programs what that impact it looks like? And I think in other sectors, we have over the years developed a more universal measure. So, for example, in RMNCH programs, maternal health programs, you have more universal measures for things like ANC care and PNC care. You have things around like neonatal health and mortality. There are things that are measured and common across different programs. So funders have confidence in that. Whether those measures are right or wrong, or whether or not they're actually measuring the right thing, is a whole other conversation. But we don't really have that in mental health. So for trust-based philanthropy, when we're trying to kind of essentially rejig the power dynamics between organizations that are doing really great work and organizations that have money to fund that really great work, you ideally would hope that philanthropists and foundations would just trust that the organization knows what they're doing and are measuring impact because they truly, they're doing the work because they want to do the work. But for philanthropists, understanding how they could potentially compare what their funding is going is difficult. And I think there's a really interesting kind of it's not really a new wave of thinking, and I know there's a lot of pushback on it, but it's an interesting thing a concept, especially in philanthropy, to think through, is this idea of like effective altruism, or another way to potentially parse that is thinking about like dollars for impact. And is there a way or a unique measure or a common measure that can be used in the mental health space where you can say, okay, for every $50 put into this program, on the other side, you get 1.2 well-bees, which is a measure of well-being. Not saying that's the right metric, but is there a way to try to elevate and engage philanthropists in a way that makes sense to them, that you're speaking that language to help kind of even that playing field? So it's an interesting concept, and I have no answers, but those are the kinds of things that I think through when I'm working with an organization and trying to figure out how do we speak the right language for this particular foundation or funder or philanthropist in order to make sure that we can really get them on our side and really have them believe in the work that we do. So after this first round of reporting, this first round of engagement, we can build that trust-based relationship and continue working together.
Thank you very much, Christy. I see that Kitaki has put the link into the chat there for the report that she and Kapi have produced. I would strongly recommend that you download it because it's a really interesting report. It's still pretty unusual to have such a comprehensive document on philanthropy in a particular country, in this case in India, which I think is really helpful. I'm just putting my email into the chat for a particular reason. When I was at the Scholar World Forum recently, a coalition was announced of mental health organizations working on the whole question of trying to find a common measurement or a common output which would be useful to philanthropists and to other funders. And I'd be happy to share information with you on that. There is no website, etc. It's a very simple white paper, and so I'd be happy to share that with you and then make sure that you are in correspondence with the people who have brought that into being, mostly from Rwanda and Kenya at the moment, which is, to Jasmine's point, it's an interesting feature in itself that here is another initiative from the Global South, also Zimbabwe in the context of Dixon Chibanda. So Sashi, I see you have your hand up. Very welcome. Please just say who you are and make your comment or ask your question. Welcome.
Hi, thank you so much. I'm Sachi. I'm based in Bombay from an organization called Ashiana Foundation. We work with children and youth at risk in childcare institutions and once they step out in the community. I think firstly, thank you so much. The report was amazing. I would love to read it. I've just heard your insights. I think a couple of things that I was wondering is, does the report cover alternative therapies? Like one is a very traditional, counseling based services, psychiatry based services that we're talking about. But what about, because especially now in India, dance movement therapy, theater therapy, God knows how many therapies are there. So all these things are coming up in India and very fast. And so does that include funding provided to, them? The second thing is that what I'm seeing is a lot more foundations are setting up their own initiatives, Empower to begin with. What I'm feeling is that there's already a lot of organizations struggling for funds in the mental health space and wondering where this is coming from. Like, why is this a problem of not being able to show impact or trust, or what it is as to why foundations would choose to start their own initiatives versus fund already existing best practices in the country. And the third thing is, when we're looking at scale, often foundations and CSRs are coming with a lot of money. Scale is possible, but scale and quality doesn't necessarily go hand in hand. So we are also seeing mostly scaled projects with very poor quality. So that's the other observation that I would say, which I am seeing. And one last thing is that with CSRs, how are we going to influence them to bring, because even in their health subsections, mental health doesn't feature. So how can, or what are your thoughts or ideas on how can we influence CSRs to invest in mental health? I guess one other thing was that in terms of specialists, we have a lot of counselors, but no psychiatrists. And so again, when we're talking about policies and things like that, how do we increase that and, maybe create funding for having more psychiatrists in the country? I don't know. These are some of my thoughts. Thank you so much. Sorry for taking more time.
No, it's great. You've given us a whole webinar in one go, which is great. I don't think Ketaki is going to be able to answer everything. I think that would be a bit much, or comment on everything. I see that Disket has a hand up to comment on one of the things that there were, but let me just go to you first, Ketaki, and then I'll come to you, Disket, and then Nandita, I see you have your hand up for another. That's fine.
I'll just start by saying thanks, Sachi. And I think a lot of the points that you've raised are extremely relevant. But in mental health, we do have a lot of open questions that we don't necessarily have all the answers to, and we're kind of discovering and figuring it as we go along. In terms of the report, you asked about alternative therapies. So we haven't actually broken it down in terms of a specific mental illness or different kinds of therapies. Now, what you call alternative therapies like movement-based or dance-based or something integrated with another socioeconomic aspect, we've kind of bucketed a lot of those under the community mental health initiatives bracket, because there are a lot of organizations actually that don't have a core focus on mental health necessarily, but have included mental health as part of their initiative. So, for example, we have this one, we looked at this one nonprofit called the Law Foundation in Bihar, and they're funded by the Mariwala Health Initiative, and they actually provide legal aid to inmates in the prisons in the state of Bihar, but also provide things like peer-to-peer counseling and support for their families. So that's kind of how we've bucketed it. In terms of CSR, actually, this is something that came up in a panel discussion we had when we launched the report. And I think the panel actually agreed, and they're all experts, that there are actually specific areas where CSR can play a role. So, for example, rehabilitation. A lot of nonprofits told us that there are long stay patients that need to be subsidized because they don't actually have caregivers. And a lot of these long stay homes need to be rebuilt or need new infrastructure. And so CSR, which is kind of very outcome oriented or output oriented, can look at those types of things. CSR can also funding capacity building, and they can fund training programs. They can fund the development of technology at the back end that can help community volunteers in data collection. So if you really put your mind to it, actually, there is a lot that CSR can do in mental health as well. And, as one of the panelists said in the last webinar we had, if you want to try and get more CSR funding, it's important to kind of find that one champion within a company or a department who might have gone through mental health experience, and, they kind of then really get it and kind of hope that and persuade them to take it forward, and help them to champion your case, getting the funds that you need. So I'll pass it on. I'll pause here and pass.
That's great. Disket, did you have a comment on Sashi's points? Is that what you wanted to do?
I thought I'll quickly come in because ours is a foundation that operates its own mental health initiatives and doesn't directly co-grant or grant funds to other NGOs. And again, I just wanted to say that I feel like a lot of foundations take different approaches. Ours started in the middle of the pandemic, where the quickest thing was to set up a national helpline that was accessible to people across the country, and there weren't those many of those. But again, I do feel like the point made is very relevant, that there are a lot of very good NGOs doing work and there's no need to replicate, and therefore funding them would be a better option. And that's something that our foundation is trying to do as well now from the coming year onwards. But again, I would say that I feel like it doesn't always come from a lack of trust, but it definitely helps to have at least a small project being run within the foundation, because that definitely gives the funders and the donors themselves a better understanding, more patience of what is actually required by an institution that works in mental health. So I think that's definitely happened with us, where because we've run the programs ourselves, the funding family definitely has a better understanding of why patience is required, why more compassion is required, why you need to not only take care of your beneficiaries, but your own employees and things like that. So I think that hybrid model now, at least for us, will work perfectly.
Thank you. We're nearly at the end of our session. We have Nandita to speak, and we are going to invite her in a second to do so. And I see, Jasmine, you have your hand up. And at the same time as you speak, Jasmine, I'll ask you just to sort of give a little wind up from your point of view. And then I'll ask you, Disket, to wind up from your point of view, and then come back to you, Kitak, at the end, just for a quick session, for a quick wind up. Just to say that this webinar today is being held by the Mental Health Collaboration of Catalyst 2030. And if you'd like to join, for free, by the way, it's a great free gift. If you'd like to join Catalyst 2030 and become a member of our collaboration, you're very welcome. Some of the individuals on this call are, who in fact might not apparently have an interest in India, are in fact members of the Mental Health Collaboration and are here to support the whole question of mental health across the world. And that would be Al Hassan Muhu, for example, and there are many others. So do please join us. I think we're going to put the, yes, we just put it into the chat now, the link. Thank you, Lana, for doing that. And also I noticed in the link a little bit further up in the chat, Christy kindly gave the link for the Coalition for Scaling Mental Health. Thank you for doing that. And again, please do look at that. And if you're interested, do go directly to the founders of that, because that would be, I think, something rather fascinating. If you'd like to copy me so I can encourage that, please do so. But otherwise, please go. Now, Nandita, we have just a few minutes left. Over to you.
Thank you so much, Chris. And I just want to begin by congratulating Cappy for this wonderful report. I haven't gone through it, but I will do that. And I think this whole conversation echoes a lot of the conversations and frustrations that we face. So I'm the country director in India for an organization called World Being. And we do work in what I saw in your box as the overlooked area of prevention and promotive inner well-being is what we like to call it. So just 2 quick points, because I know we are running out of time. One is that, if it's in your report, that's great, but I just want you to reflect a little bit on what is it that's really stopping philanthropists, okay? And what is it that they're looking for? So I do understand this thing about impact and, quick returns, but I think there are a host of social areas, that do get funding from philanthropists, which are very similar in the way the impact pans out as mental health. So is it visibility? Is it a lack of understanding? Is it the fact that there's a lot of noise but no common language? Because, I feel that is something that can really be helpful to bring together and advocate for efforts. Secondly, just leading to that, is there any guidance or any reflection on who could be advocates to kind of bridge this gap? Because I feel in India, interestingly, policy guidelines and initiatives on prevention are actually quite well laid out. I mean, I would say in the last 4 to 5 years, there's been a very interesting, emergence of these kind of conversations in the policy space. And yet they don't seem to have percolated down either amongst philanthropists, or I think among, a lot of organizations trying to push that. And finally, I said 2, but 3 on this innovation and scale. So I think there seems to be a comfort in funding innovations. And I wonder, what is it that kind of has philanthropists stopping back from going into scale? Is it the length, really, of the intervention? Is it the quality that we talked about? Or is there something else? And I'm wondering if your report does actually go into some of that. It can't do everything, but it's a wonderful start. So I think we're a little greedy about what all can happen. Thank you.
Thanks very much, Nandita. Nandita, just before I go from you, how many people are you serving at the moment?
So we are doing a scale up through the education system. So we have about, I think, let me see, 1.5 million people, teachers and students. Yeah.
Right. That's mostly in the state of Bihar, right?
Yeah.
Okay, thank you. We've come pretty much to the end of our session. Jasmine, do you want to make maybe a point that you wanted to make earlier? And then if you'd like to just give a finishing remark, I'll come to you, Disket, for the same, and then we'll finish Ketaki with you. It only seems fair that we finish with you since it's your report. Jasmine.
Maybe given the time, let me just wrap up. I think the only request to philanthropists would be to play to their strengths. And if it is funding and not implementation, then they should just stick to funding. 2, I think mental health is not a silo. It intersects with all other sectors. So philanthropists who are keen to fund mental health, please integrate it across sectors and not look at it as a silo. Thank you very much. You obviously have worked with the press. Those are great little segments for us to quote. Thank you very much. Disket, over to you.
I'll quickly, I think, just add one new point because I don't want to take up too much time. But I think we've, in the report, also emphasized on community care models. And I think WHO emphasizes on that level of the pyramid being very important. I think in India, that is really the need of the hour. I just want to add one layer to it. I feel like when we speak of community care models, somehow the conversation only leads you to rural India. I just want to leave a point here when we're all on board is that urban India is really struggling with an immense prevalence of common mental disorders. And therefore, I feel like the community care models will also work very effectively in urban India and are highly needed in urban India. So I think I just want to leave the panel with that one small thought.
Yeah, very good point. And if Sashi had her opportunity, she would actually be emphasizing that. But unfortunately, Sashi, I just have to do it for you. Please forgive me. Over to you, Ketaki, to give us a final wind-up.
Yeah, I think, of course, thank you so much, Chris and Catalyst 2030 for organizing this. And Nandita, I take your points, and I would love for us to carry the conversation on offline. I've left my email ID in the chat, so please do get in touch. Just a final thing, I think that India has a real opportunity here, like Jasmine said earlier, to reshift the narrative and come up with innovative models that work for the global south. I think our diversity means that we can be an ideal testing ground for donors and nonprofits to really showcase, many different approaches in mental health and kind of help export our learnings to the rest of the world as well. And I'll close with that. I hope that all of you, I hope that the report is helpful to all of you, and I would encourage all of you to download it from our website.
Absolutely. Well, very warm congratulations on the production of the report. I think it is going to prove to be an incredible resource right there. And it sounds to me as if it's also the beginning of many other different discussions, questions, reports, and activities as well. So that's fantastic. Jasmine, thank you so much for being one of our speakers today. Really appreciate your comments and the wisdom that you bring to the meeting today. Disket, thank you so much for coming to us today. I think coming from the particular orientation of a funded program, that gives us a very special and specific kind of insight, which I think was very helpful. And once again, thank you for your wisdom as well. So I wanted to thank everybody for attending the webinar. We've had a wonderful turnout. It's been a very interesting subject, and I can only think that we're going to have to continue with this. I'm keen to follow up on the idea of repositories with Ketaki. I can see that that's something that's buzzing along, and just to say thank you all for attending this webinar. All the best.